Too many men are told that their prostate is enlarged. Unfortunately, that starts this conversation that just starts to orbit around and around the size of the prostate. But size alone does not dictate how obstructed, how blocked up the main water pipe is in your body. It is so important that we take time just to establish why prostate size is only one element that needs to be considered when you make the best decisions about your prostate and your bladder health. Welcome to BPH 360, where bladder health matters. I'm Dr. Kuang, Cleveland Clinic trained urologist. BPH is not just prostate enlargement. It's about protecting your bladder. Learn to ask better questions. Take control. For education only, not medical advice. For your care, consult your doctor. Too many men are making that assumption that their problems passing their urine is all about prostate size. Big prostate, big problem. Small prostate, small problem. But that is too simple. Yes, it seems logical. Yes, it sounds clean. And yes, it sounds somewhat medical. But the truth is, prostate size is only one of three key factors that you need to be asking about when you ask your provider or your urologist, hashtag, what about my bladder? Because it's prostate size, prostate shape, and your bladder function. Together, those three things help shape how you make a decision about your bladder health. We talked about how the prostate starts off about the size of a golf ball, but in the shape of a donut. And as you get older, the prostate gets bigger, but that donut hole right here is going to get tighter, restricting and constricting that main urinary pipe that carries urine out to the tip of your penis. As a result, you can have a very large prostate, but as long as that donut hole is big, you will not have an issue peeing. On the other end of the spectrum, you could have a very small prostate. But if the donut hole is very, very tiny, you're actually going to have a very hard time passing your urine because the main urinary pipe is very tight. So let's talk about prostate size. When urologists are talking about it, we are giving it a number, and you'll see here, this is a normal prostate. That's 15 grams. The next one is 32 grams, and this bigger one is 54 grams. Now, this is when you're a very young man, and as we get older, it gets bigger. What we have found is that men can even grow them to be up to 4, 5 times, 6 times this size as well, 200, 300 grams. So you can see there's quite a breadth of sizes that men can have. And the reason why we use grams for you science folks is the weight of 1 cubic centimeter is a gram. So that's the unit we've used and adopted for prostate sizes. The classic way with which we measure the size of your prostate is actually with our finger. Yes, the finger wave. Yes, the digital rectal examination. And as I show you this diagram here, you're going to see there's the bladder sitting on top of the prostate. Once again, we now recognize it's like a donut. And here's the donut hole through which the urine is squeezed through this main donut hole into the main urinary pipe and out through the penis. Now, we can use our finger. This is the anus. And as we allow the finger to come in, the doctor can then feel that back surface of the prostate. But if you notice, the one thing it cannot assess is that donut hole. It's too far away. And so, why do we want to then know the prostate size? Prostate size is an important factor that can help you choose the best management strategies for your bladder health and prostate. As you can see on this diagram, this is actually from the European Association of Urology. They have guidelines, and they can show you here how prostate volume or prostate size helps dictate technologies listed below. But here they've divided it up by less than 30 grams or milliliters is what they're using here For all of those who are science-oriented, yes, 1 milliliter of water is a cubic centimeter, which weighs 1 gram. So you'll see they've divided up the prostate sizes by less than 30, 30 to 80, as well as more than 80. And based on those size criteria, you can then offer a patient certain technologies and techniques based on the size. But it's not just in Europe, it's also in other parts of the world, such as here in the United States, where, once again, how we determine surgical therapy to deobstruct and open up that donut hole is often determined by the size. And here you can see the assessment of prostate size. We talked about how it can be done with your finger, but later on we're going to talk about using technologies to help assess size as well. We can use imaging, a CT scan, an MRI scan, an ultrasound, or even a cystoscopy. And that's where we use a camera to go into the penis and go up to the bladder. And along the way, we can get a sense of the size of the prostate as we pass through that donut hole of the prostate. And as we see on this diagram, they break it up in very similar size ranges. Here we see a small prostate less than 30, an average prostate 30 to 80, and a large prostate more than 80 up to 150, or even very large prostates more than 150 grams, or as you can see in this diagram, cubic centimeters, which you now know is also a milliliter. For each of those sizes, we can then offer different types of technologies and techniques. It is important to remember that you can have 2 different men, both with the same size prostate, but 2 very different experiences because of the donut hole. One man could have a very large donut hole, and in that case, he has no issues passing his urine. The other man could have a very tight and constricted donut hole, and as a result, he could be complaining of voiding symptoms, slow flow, straining, intermittency, as well as storage subscores like urgency, frequency, getting up in the middle of the night to pass urine, or even incontinence. Now, if you look on this diagram here, I just wanted to take this one level deeper. I want you to imagine that you are inside the bladder, and now you're going to look down at the donut hole of the prostate, and this is what you would see. What you're seeing here is if you were looking down into the prostate, here's the overall prostate size, and now you can see the donut hole where this anatomical specimen shows that donut hole is tight. And remember, don't fixate on just one element of just prostate size, because it's so much more than that. It's prostate size, prostate shape, as well as your bladder function. Yes, prostate size matters sometimes. A larger gland, a larger prostate size can increase the likelihood of trouble, but size is a very crude parameter. It does not tell us exactly what the donut hole looks like. And that's when we start talking about prostate shape. I want to show you once again that a model that we've talked about before. As you can see here, here's the bladder, here's the prostate, and as the bladder contracts, it squeezes urine through that donut hole and out through the penis. Now, what's important to know is let's realize that this is an oversimplified anatomical model. Look at this. It looks like a straight shot out to the penis. But in fact, for most men, that is not the case. And you can see that on this pathology specimen. Once again, the bladder's on the right. As it contracts, now it's challenged because not only is the prostate growing tighter and constricting the diameter, the caliber of this pipe, but it's actually changing the path, the trajectory. It's no longer straight. It now has a curve in it. And you can see here, this has a very significant curve. The urine first has to go over this hill. It hits this wall. It then has to squeeze through a tight donut hole here and all the way down to the bottom. So it's much more complex than just a donut hole getting tighter. In the human body, it's getting tighter, but it's also the pipe is changing its configuration so that it is no longer a straight pipe, making it even more challenging to squeeze the urine out from the bladder to the tip of your penis. All prostates are not shaped the same, and that's why it's really important that your urologist gets a sense of specific prostate, its dimensions, not just the overall size in grams or cubic centimeters or milliliters as we saw in those different guidelines. We can see here that one of those measurements is going to be the prostate length, and we can measure that from the top of the prostate down to the tip. You can see that with my arrow. Another measurement that can be very helpful is the width. And you can see that now on this diagram where we're looking at the full span of the prostate. Another measurement is the height as well as the shape internally of that donut hole. As we showed on that diagram, it can have a very tortuous or curvy trajectory as it passes through that prostate. Every man's prostate's different. Some grow more laterally to the side. Some grow taller. Some can also grow longer. Some create more constriction from the top of the prostate, from the sides, from the bottom. So many different configurations. And that's why we do diagnostic testing, because we need to understand not just your size, but also the shape of your prostate and how that constriction of the main water pipe looks. So then we can tailor the right treatment and the right technologies to your specific dimensions. Believe it or not, the prostate can start growing upwards, up into the bladder. In an ideal situation, you see that there's a sharp division on this model between where the bladder is and where the prostate is. But for some men, actually, this prostate not only grows and tightens up the main water pipe, but the prostate can actually grow up into the bladder and create what we call a flapper valve or ball valve effect. I want you to imagine your toilet. If you go to the toilet tank and take off the cover, when you look inside, you'll see that it has a flapper valve. And that flapper valve is at the very bottom. And once the toilet tank is filled with water, after you use the toilet, the flapper valve will cover the outlet and seal it. As you can see on this diagram, this gentleman, his prostate is growing up into the bladder. Here is the bladder. The white is the urine. And you can see here in the shape, in this case, of a heart, this is part of his prostate that's growing up into the bladder. So when the bladder tries to squeeze this urine out, that part of his prostate in the bladder acts like a flapper valve and actually will cover the opening of the donut hole, making it hard for him to pass that urine through the prostate and out to the penis. As you can see, there are many different types and configurations and shapes of prostates, and that's why diagnostic uncertainty always exists. I hope that gives you a better idea about how prostate shape, while it is a factor, it is not the only factor, because the dimensions, the shape, the configuration of your prostate also plays an important factor in your choices to help you live the best version of your life, incontinence-free and catheter-free. And the last factor to consider is your bladder function. Specifically, remember, we call this muscle of the bladder the detrusor muscle. And so we want to know the detrusor function. And if we take a close look, once again, we can see here, this is a bladder where it has all these very thick ridges from all the muscles having to work harder. We call those trabeculations. We're even developing some small pockets in the muscle. We call those cellules. If they get very large, we call those diverticuli. Those are all signs of a struggling bladder. And that is the third factor, which is what is the status, once again, of this muscle, the detrusor, and your bladder health, because that helps dictate when you need to act and to what degree you need to intervene to deobstruct. Down the road, we're going to talk about different technologies that involve trying to open up this prostate donut hole to the most that you can, which is a maximal approach, or some fraction thereof, which is a fractional approach. And when we make those decisions on opening up the donut hole, once again, it's based on prostate size, prostate shape, and bladder health. Diagnostic testing is critical because diagnostic uncertainty always exists. We don't know if that bladder is still strong and compensating, if it's irritable and overactive, whether it's quivering or struggling or squeezing without your permission, causing leakage. Or perhaps it's actually getting to the point of being so tired, so fatigued that it's actually failing to empty or is actually beginning to completely quit. Given this complexity, no two men have the exact same situation when you factor in those three elements of prostate size, prostate shape, as well as bladder function. So when they say, well, how big is your prostate? I want you to start thinking, well, what is the interaction? What is the interplay between the size of your prostate, the shape of your prostate, and how that bladder muscle is working? Is it weak? Is it strong? Is it struggling? And that is the man versus prostate trifecta. And once you see and understand that, you will be able to make the best choices for your prostate and your bladder health. Because this matters. This channel is built around one idea. Better bladder health starts with better data for better decision making. If you're a company working with diagnostics, therapeutics, or technologies that genuinely improve how we evaluate and manage and protect the bladder, there's an opportunity to become a founding partner of BPH 360. Not to advertise, but to help move the standard of care forward through education. Now let's get back to the episode. So the bottom line is that your symptoms are not just about prostate size. When you're having voiding symptoms, slow flow, straining, intermittency, if you're having storage symptoms of urgency, frequency, getting up in the middle of the night to pass your urine, or even beginning to leak urine when you can't get to the bathroom in time, these are signs that you need more data. When you ask your doctor or urologist, what about my bladder? The second question in your head is, what data can we obtain to help me better understand the man versus prostate trifecta of prostate size, prostate shape, and bladder function? Because there's always diagnostic uncertainty. In fact, as we talked about in previous episodes, we're making assumptions that your symptoms are from that main water pipe getting tighter and being constricted due to an enlargement and tightening of the donut hole of your prostate, when in fact there can be other things going on. Bladder cancers, bladder tumors, scar tissue, bladder stones, other things also need to be evaluated. Your urologist and doctor don't have the ability just to somehow know exactly what's going on. They need to do diagnostic testing to see what's happening with the bladder function, the dimensions, the width, the height, the length of your prostate, as well as the configuration, the shape of that main channel, because more than likely it's no longer a straight pipe, which is the most often scenario seen for men as they get older. Well, your doctor, your urologist will start talking to you about different types of testing. In a broad categories, we can use things like ultrasound. We can use technologies called urodynamics that give us quantitative and or qualitative data about your bladder health. We can also start using cameras. We have colonoscopies for men who are screening for colon cancer, and we start doing that around the age of 45, 50. Similarly, we can use camera technology. We call this a cystoscope, to use a very small camera to go into the tip of the penis and go up inside to take a look at that prostate, take a look at your bladder health, take a look at the configuration of your prostate, get a sense of prostate size, as well as whether or not your bladder is struggling. So there are many tests that we can do, as well as some tests you can do at home to see how fast are you peeing. Just like if you're taking a blood pressure measurement to get a sense of your cardiovascular health, we can get a sense of how fast you can pass your urine as an indicator of how tight the donut hole is and or how strong or weak your bladder muscle is, that pump that squeezes urine through the main water pipe. All of these factors are really important, and I want you to understand that the overarching goal is to get you your data so you can make the best decisions, because we do that all the time. So many of us now have smartwatches or smartphones which gather our data on the quality of our sleep, how fast we can run 100 meters, our heart rate variability, or, for example, studying our glucose levels. These are all data points that help us make better decisions about our health. And for you and your bladder health, we recognize that along with the brain, your bladder is a major organ that cannot be transplanted. So it deserves that data. You deserve that data so you can make the best decisions to protect your bladder, to preserve its function, so you can live the best version of your life, incontinence-free and catheter-free. Next week, we'll talk about the 5 stages of bladder health. We have touched upon how this disease process of BPH is a progressive disease that over 5 years, 10 years, 15 years progresses to more serious stages. We talked about how it goes from simply slowing the flow down as that donut hole gets tighter to now the bladder muscle is struggling and becoming overactive, causing those stored symptoms of urgency, frequency, getting up in the middle of the night to pass your urine. And then it can progress to even to the point where that bladder squeezes without your permission, causing you to leak down your leg, or even beyond that, when the bladder begins to struggle, stop working, or even actually start to fail. Then when we start talking about how do we help intervene at the right time, well, we also need to factor in other things like the prostate size and the prostate shape. No two men are exactly the same. No two men have exactly both the same size and shape of prostate. No two men have the exact same size, shape, and bladder function. And the goal is for you to work with your urologist to find the right technology to intervene at the right time for your specific prostate before the onset of damage to your bladder or before the damage is irreversible, because your bladder is non-transplantable. You only get one of them, so you need to take care of it. I'll see you guys on the next episode. Thanks for watching. If bladder health matters to you, watch more. Follow BPH 360 to stay ahead of your symptoms. Listen on Spotify and Apple Podcasts.